On this Sunday night, the COVID-19 record in Alberta. More than 6,000 new cases over 3 days.
I find the numbers appalling, honestly.
The challenges facing the Jason Kenney government. The threat of an ambulance strike in Ontario, which is already under strain from ICU cases.
We welcome you back to planet Earth.
Plus, splashdown from 68 million miles out of this world. And the British challenge to pay tribute to Sir Tom.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight in Alberta, where there is frustration and fear after a record-setting weekend for COVID-19 infections. Over 6,000 new cases were reported over the last 3 days. Alberta still leads the country in active cases per capita, double the number being reported in hard-hit Ontario. Hospitals have not yet reached their breaking point yet, but with so many sick, it may just be a matter of time. Heather Yourex-West has our top story tonight.
In Alberta, the risk of COVID-19 infection has never been higher. And yet, on a weekend where the province posted a record number of new cases, hundreds of people gathered in central Alberta for a rodeo, with no masks in sight.
I do not think people are evil. I think that they are misguided. And that misguidedness is actually really damaging to the entire community, honestly.
The event comes just days after Alberta's premier promised to get tougher on those flouting public health restrictions. Alberta Health Services says it's considering legal options against the event's organizers.
The paramedic response unit.
Paramedic Nate Pike, who is also running for a seat on Calgary's City Council, says he encountered a large gathering over the weekend too. It was right outside the Emergency Medical Services headquarters. He says he struggled to control his anger as he approached the crowd.
And I just said, look, you guys, this is real. And when we come home after 12 hours or however long of trying to fight this thing, and we see a bunch of people having a party on our front doorstep, it hurts.
The fact is, the stakes in Alberta are higher than ever before. This week, Alberta Health Services met with staff to discuss its COVID-19 triage protocol, a guide for which patients would receive care in the event hospitals become overwhelmed. It's something Dr. Noel Gibney believes could happen in as little as 3 weeks' time.
Looking at modelling that to date has been remarkably accurate, we could hit that threshold anywhere from May 22nd onwards.
Still, Alberta's current level of restrictions are less than what was in effect during the height of the province's previous 2 waves. Patios remain open, malls, churches, and hair salons too. What is closing is the Alberta legislature, the province cancelling its spring sitting for at least 2 weeks to prevent, the government says, COVID-19's further spread. Heather Yourex-West, Global News, Calgary.
In Ontario, some medical experts warn the province is nearing the COVID-19 triage protocol stage where they'll be forced to choose which patients live and which die. Catherine Ward has more on the ICU situation in the hardest hit regions of Ontario.
Emergency departments and ICUs, key battlegrounds in the fight against COVID-19.
Our ICUs were still full from the second wave when we started receiving more patients from the third wave.
Hospital capacity and staffing are where success and failure are in a constant state of flux. In Ontario's York region, north of Toronto, Dr. Steve Flindle sees this play out daily in the ER.
I remember a day when we said 350 ICU patients would mean hospitals couldn't function properly. We're more than double that now. And the ramifications from that are going to last months, if not years.
Critical Care Services Ontario reports another 51 ICU admissions Saturday. There are now more than 2,000 patients in critical care across the province. 886 are there because of COVID-19. In Peel Region, Dr. Andrew Healy says triage protocols have not been required and hospitals have the ability to care for anyone needing help. But he says continued vigilance is needed.
If we take our eye off the ball, we are certainly at risk of getting to the point where our numbers would exceed our ability to care for people.
On top of all this, union members with Orange paramedics have voted 94% in favor of a strike if necessary. The workers have been key in helping transfer critically ill COVID patients to ICUs across the province. The Union for the Emergency Helicopter and Ambulance Service wants the Ford government to exempt them from Bill 124, legislation which forces a 1% wage increase cap and also limits bargaining rights.
They're the only paramedics across the entire province that are captured by this legislation. So as the Premier, he has the right to waive the legislation in this circumstance.
Over in Scarborough, Dr. Lisa Solomon says she worries about how much more the system can handle.
Really, we don't have much more capacity left, and people really need to understand that we're getting very close to maximizing our capacity.
Catherine Ward, Global News, Toronto.
The U.S. is seeing a similar trend as Canada in the demographic ending up in hospital with COVID-19. 35% of new admissions are now people in their 20s, 30s, and 40s. But younger people are shying away from getting their vaccines. And as Jennifer Johnson reports, the vaccine supply is beginning to outpace demand.
After racing to vaccinate older and elderly Americans, a population hit hard in earlier waves of the pandemic, doctors are now seeing a clear demographic shift in new COVID-19 cases. Young adults are filling up hospital wards.
Young people have this misconception that COVID is no big deal. It is a big deal, and we've seen a lot of young people now hospitalized, young people with long-term infections that go on for months and months and months.
States have opened up vaccination sites to everyone over the age of 16. Following an unprecedented rollout, vaccination rates are now dropping by about 500,000 a day nationwide. Doctors are telling young people the vaccines are their best weapon against the virus, but they're hearing a different story on the internet.
In social media, there are a lot of rumors going around about how the vaccine is not important or how we don't need it because we're not at high risk.
Many young adults are also being told the shots will make them sicker than COVID-19 will, which medical experts dispute.
People who are saying that, they feel sick for a long time, that it's not worth it.
Young adults 18 to 30 make up the highest number of unvaccinated people in the country. Some states, like West Virginia, are using incentives, offering a $100 savings bond to anyone 16 to 35 who gets vaccinated.
Our kids today don't really probably realize just how important they are in shutting this thing down.
Some young adults don't need convincing, anxious to get back to life as they once knew it.
If everyone gets their vaccinations, then hopefully we can go back to school normally without masks. You can hug your friends if you want, sit at lunch tables together.
Many colleges are now taking a hard line, requiring students be vaccinated before returning in the fall, so that this school year isn't a repeat of last year's. Jennifer Johnson, Global News, Washington.
India has recorded its deadliest day of the COVID-19 pandemic. In the last 24 hours, more than 3,600 people died. It's the fourth straight day India has experienced over 3,000 deaths. Ottawa has sent $10 million to the Indian Red Cross. And as Mike Le Couteur explains, it's now looking for other ways to help. And a warning, some viewers may find images in this story disturbing.
All this woman wanted was to bring her dead husband home, but with no ambulances in sight, she was forced to call a rickshaw instead. This is how bad it is in India. The South Asian country has recorded 250,000 confirmed COVID-19 related deaths since the start of the pandemic. The actual death toll is likely much higher. Indo-Canadians are left feeling helpless as they hear horrifying stories from family.
I talked to my cousin this week, and she had told me when she was waiting to get her vaccine at her local hospital, there was one body being transported every minute past her who died from COVID.
Medical oxygen remains a precious commodity in the country, even as shipments start to flow in by train. Help is slowly trickling into India from the international community. Germany's shipment of 100 ventilators landed in New Delhi overnight, and Uzbekistan and France also sent medical equipment.
Each of these units can provide oxygen during more than 12 years to a 250-bed hospital in India.
Canada's contribution so far has been cash, $10 million directly to the Indian Red Cross for immediate needs, and talks continue about sending equipment like ventilators.
The Public Health Agency of Canada is, reviewing what we have in our national stockpile, and first and foremost, making sure that, what we can send is not something that's needed here in Canada.
Now, some in Canada's South Asian community are even suggesting gifting the remaining 1.5 million vaccine doses we were supposed to get from the Serum Institute of India back to the country considered the world's pharmacy. While India has halted all vaccine exports, Minister Gould says it could be part of the conversation when doses begin flowing again.
We want to make sure that Canadians get their second dose of the AstraZeneca vaccine, whether that comes from the Serum Institute or whether it comes from another area. We continue to work on that.
Understanding that the global pandemic won't be over until it's over in every country across the world. Mike Le Couteur, Global News.
Some countries are beginning to get out of this pandemic because of an effective rollout of vaccines. The distribution of vaccines began last December. In under 5 months, Israel has managed to get at least one jab into 62% of its population. For the UK, it's 51%. Canada is now just over 33%. Even in the throes of a lockdown, there are signs in this country that vaccines could turn the tide in the weeks ahead. Eric Sorensen reports.
As long lines snake towards vaccination sites and Canadians, masked and desperate for shots, wait hours for pop-up clinics, it's hard to imagine when normal will return. But it is happening elsewhere. The masks came off in Israel this month, and nightlife has returned in the UK.
Honestly, it feels so good. It just feels like we're out of prison.
What the UK and Israel have in common is a high percentage of vaccinations.
There's no question that we're starting to get the pandemic really well under control at the moment.
Canada is just beginning to catch up. After a slow start, this country has overtaken most G20 nations in administering vaccines per capita. And led by Pfizer, Canada will double its weekly total to more than 2 million doses a week starting this month. So, when will it make a difference?
As you get more people immunized, it makes the disease less transmissible to others. So, as you get past 50, 60%, you see it happening in terms of less cases.
With an accelerated vaccine pace coming, half the population in Canada could get a first dose by late May. Public health officials see 75% as a threshold when a semblance of ordinary life could return.
The types of restrictions I think that could be looked at obviously would be maybe encouraging more sort of outdoor gatherings in terms of people being able to get together.
It will depend on other factors. COVID variant hotspots are less likely to open as early as other areas. And getting to 75% depends on Canadians continuing to march in for their shots, which they are doing. An Ipsos survey in November found barely half, 52% of Canadians, would take a vaccine as soon as they could without hesitation. A February survey saw the number rise to 66%. And in April, Ipsos found 75% would take a vaccine as soon as possible, no hesitation.
Vaccine enthusiasm is important. More people are talking about it. There's more opportunities to get vaccinated. With people enthusiastic to take the vaccines, that's only going to help.
With vaccines coming in bigger numbers and a high willingness to get a jab, Canada could be among the few countries that can lift restrictions and be well protected by sometime this summer. Eric Sorensen, Global News, Toronto.
Coming up, Afghanistan on high alert as American troops begin pulling out. Police dashcam footage captured a heart-stopping collision in Australia. A large truck was slowing down on a highway because of poor visibility from a fire nearby. That's when another truck hit it from behind. The officer who was watching this all happen managed to get out of the way. Luckily, no one was seriously hurt. In Afghanistan's capital, a fire rolled through several gasoline tanker trucks, killing at least 7 people and injuring 14 others. The cause of the incident is under investigation, but officials have ruled out a terrorist incident. Still, Afghanistan is on high alert because of threats from the Taliban, and the U.S. has begun withdrawing troops with a final deadline set for September 11th. Israel is observing a national day of mourning to remember the 45 people, including 2 Canadians, killed in a stampede. Hundreds sang and prayed during a spontaneous memorial last night in Jerusalem. 45 people, including 2 Quebecers, were killed on Friday in a stampede at an annual religious festival. Tens of thousands of people attended the event. Still ahead, helping the men behind domestic violence. The commander of Canada's Special Forces Unit has been placed on indefinite leave following revelations he wrote a letter in support of a soldier found guilty of sexual assault. 4 years ago, Major General Peter Daw wrote a character reference for a soldier convicted of sexually assaulting a comrade's wife. A statement from the acting chief of the Defence Staff says, "We must keep learning and ensure such situations are not repeated going forward. In doing so, we must always have the victim's perspective at the forefront and be accountable for our actions." The move comes as retired Supreme Court Justice Louise Arbour begins a review of the military's approach to sexual misconduct. In this country, 1 woman or girl is killed every 2.5 days. That's the finding of a report by the Canadian Femicide Observatory for Justice and Accountability. In Quebec, the government is calling it a crisis after 10 femicides in less than 5 months. Now, the province is planning to spend $233 million to stop violence against women, and nearly 10% of that will go to organizations to help the men committing this violence. As Amanda Jelowicki reports, experts say men need more resources to change their behavior.
It's a staggering number. Since January, 10 Quebec women have been killed because of suspected domestic violence.
Please ask for help. The help is there.
Calling the situation a crisis, the Quebec government is spending millions to help, this time investing in programs that support violent men.
We have to address the source of the problem, which is being able to help men, violent men, who ask for help.
Geneviève Guibault says the emergency $20 million will go to 34 male support groups across the province.
It is an additional 30% of money that is given to the organizations to make sure that they are able to hire more people.
Experts say men are often overlooked when it comes to domestic violence. About 10,000 men ask for help each year, but few resources exist.
If they're not serviced right away, their anxiety grows. They can become a little bit more hopeless, even angrier.
Darrelton James helps counsel violent men. He says traditionally they are just thrown in jail and not offered help. He believes that needs to change.
Men do require services, not just punishment or consequences. Simply going to jail does not help them reintegrate back into their families.
Groups who support women welcome the investment, but they say more collaboration is needed to truly tackle the problem.
Can we work together? Can we sit down together? Because they need our expertise to provide an adequate safety net to the woman. As long as the government will work in silos, it won't be strong enough.
Men currently wait about 2 months before accessing group help. The government hopes its investment will cut that number in half. Amanda Jelowicki, Global News, Montreal.
Up next, from climbing walls to eating Maltesers, how Brits are paying tribute to the captain.
And on behalf of NASA and the SpaceX teams, we welcome you back to planet Earth and thanks for flying SpaceX.
Mission Control also joked that the astronauts earned 68 million miles for the frequent flyer program. The 4 returned to Earth in the first nighttime splashdown of a NASA crew since 1968. They came home in the same capsule, Resilience, that they left on 5 months ago. It's been 3 months since the loss of Captain Sir Tom Moore from COVID-19. The British war veteran raised millions to fight the virus with his 100th birthday challenge. He would have turned 101 on Friday. So this weekend, people across the UK are doing their own challenge in honor of Sir Tom. Here's Crystal Gumansing.
On what would have been Captain Sir Tom Moore's 101st birthday, his family kicked off a new chapter building on his legacy.
We want people to pick up that number 100, join us in the challenge, do anything you can and raise money for charity, the Captain Tom Foundation or any charity of your choice.
Moore gained worldwide recognition last year. He walked 100 laps of his garden and with every step raised millions for the UK's National Health Service.
You know, we still feel his loss. It's just a few months since he died, but this is so powerful because here we are in his legacy, the lasting legacy of hope he gave to us and to everybody.
Hope, it turns out, is still in great demand, but there is a large and dedicated team ready to step into more shoes. The challenges are all different, but the goal is the same. Complete a task 100 times in support of a charity.
Hi, I'm Harmony and I'm going to be climbing this wall 100 times for Captain Tom.
It's difficult for Harms, but she does like to push herself, don't you?
Yeah.
We heard about the Captain Tom 100 challenge.
We had to do it.
We just had to do it because Captain Tom has the same hopes, they have the same beliefs as us.
The belief that everyone can make a difference. Harmony Rose Allen is raising money to build an accessible playground at her school.
I don't need my sticks.
Many of the challenges are truly inspiring. Others, well, they're more delicious.
I'm going to eat Maltesers. My fave. Here we are. 99 to go.
Celebs are definitely adding flavor and flair.
What he's brought us, of course, with the Captain Tom 100 that we've talked about before is this incredible ability to cross the boundaries of gender, race, social status, nationality and age.
No boundaries, just hope through action.
99.
Crystal Gamansing, Global News, London.
100.
And that is Global National for this Sunday night. I'm Robin Gill. Tonight, your Canada is the Kennebecasis River in New Brunswick. Thanks for watching. Good night.